we've got the various symptoms, like I explained earlier. Like we have something called the vasomotor symptoms, which is like when the pituitary gland, which is like a gland here that helps with the other hormones in the body, is trying to stop producing the estrogen. A lot of things go on, and I call it like is recalibrating. And while it's doing that, women can experience what we call hot flashes or flushes, night sweats especially. They just can't get cool enough, problems with sleeping. And what most of the patients tell me is, I just wake up from nowhere and my eyes are just wide open. It's not that and I can't get back to sleep until morning. And mood alterations, just swinging moods, brain fog. You want to say something, you just can't get it out of your mouth, but you know what you want to say. And sometimes difficulty concentrating, changes in blood pressure, and low energy levels. And with that low energy levels, I don't just want us to think it's menopause only, because sometimes there can be other pathology going on, like there can be other problems going on. So it's always good with this box. You need to see a menopause specialist who is going to assess you and help with the symptoms. So I'll move to this next slide, which you can see there's a little lady there. And that's what also the physiotherapist can work with you, as well as, like a psychosexual therapist as well. So, and gynecologist. So also women have problems with intimacy during menopause, because when we lose estrogen as women, the vulvar area, which I'll be showing you later on, becomes drier due to loss of lubrication. And when there's loss of lubrication, that's the tissues around the vulva and the vagina area, becomes very sore. And the degree varies from woman to woman. So for some women, they don't even feel it. And for some women, I always joke with some of my patients. I say, you are just an estrogen girl. Your body likes estrogen, and that estrogen has been taken away, and we can just see it all over your body. So with that, you may need to see a physiotherapist as well as a gynecologist or a sexual therapist as well. And also, let's move to this big slide, which is where I see a lot of women complaining, apart from the vulvar dryness and vagina dryness. Women can also start developing bladder and bowel problems at this time. It's not uncommon when women come to clinic, they tell us, I've been fine all these years until I started menopause, and I just don't know what went wrong. It's like everything just gave way. So with that, there's a way we educate you. We encourage you to start your pelvic floor exercises, and I'll talk to you about that later. And then we also practice vulva care. And also, women can experience a lot of hair loss and excessive dry skin during menopause. And also, it's more difficult for women to lose weight. So I always joke, I say, look, if you know you don't want to be, you don't want to put on too much weight, once you hit 50, you need to start cutting down what you eat at 40, because it's not just going to, be overnight. You just need to make sure that you maintain a healthy weight prior to you getting into menopause, because it becomes more difficult for women to lose weight because of that loss of estrogen. And also, some women, if they've gone into early menopause, there's something we call osteoporosis, which is just like thinning of the bones, because the estrogen helps the calcium to be absorbed into our bones. So when women lose that estrogen, calcium is not being absorbed properly into the bones. So, and that can lead to what we call like brittle bones, which is called osteoporosis. And we can also have reduced muscle mass due to aging as well. So we've covered all these, and I will talk about how we can treat this in more details in subsequent slides. In summary, remember, Menopausal symptoms varies. It's not the same. You can't compare yourself to your mom. It's old wives' tale. Because when I was kind of growing up, they say, oh, if your mom went through menopause this way, it's going to be something similar for you. It's not going to be the same. It's not going to be similar to your sisters. It's not going to be similar to your friend. So you can compare notes because we women like to chat and compare, oh, do you go through this? Do you go through that? But every woman is different. The onset of perimenopause and menopause is different. The average age for perimenopause is 47.5 years, and the average age for menopause is 51 years. And the severity varies, and treatments should be personalized. It should not be one size fits all. So, how do we manage menopause? So, I'm going to focus more on my own specialist area, but I'll touch on other things. How I help women to improve their pelvic floor dysfunction or sexual dysfunction during menopause, or if they start experiencing symptoms of prolapse. So, the next slide, before I just put this here, just to kind of pre-warn you, I'm going to show you a diagram. It's not a picture. It's going to be a diagram of the female vulva. Based on my clinical experience, I've observed women don't really know the difference between their vulva, the perineum, or the vagina. And that can also make it difficult for women to express themselves because when you go, or because it's a private and personal part of the body. So when we go to the GP, we know something is wrong, but just because you don't really know how to describe what is going on, then sometimes you may not be taken serious or women are not taken serious. So this next slide, I will show you, it's about a diagram of the female vulva. So I'm going to go through this vulva, this diagram, um, you know, addressing the diagram one by one. I don't want you to just focus too much on the anatomical name. So I like this picture because it's also showing you like the layman's term, the name we call it. Let's start from the top here. We have the pubic area here, and we have the mons pubis there. And then just underneath, if you come down here, we've got what we call like the clitoris there. And coming down, we have two lips. We have the outer lip and we have the inner lip. And medically, we call it the labia. And some people also know it as the labia. And just underneath there, we've got the urethra opening. And this is where we wee through. This is where the wee comes out. Because I've asked some women previously in clinic, and how many openings do we women have? Some will say two. And I'm like, really? Are you sure you're a woman? You should have at least three openings there, one for the wee, one the vaginal opening, and one for the bowel opening. So this area is called the vaginal opening, and the vagina is inside. This all bit outside is called the vulva. This outside bit is not called the vagina, it's called the vulva. The vagina is inside, and I will show you that in the next slide. So this next slide here is just to show you the pelvic floor, which I always like to talk about briefly when I'm teaching or presenting. So that's the vulva there. And this inner bit here is the vagina, which is the middle opening. Then we've got the bladder here, and you've got the urethra, which is also called the wee-wee pipe. And then we've got the back passage, we've got the rectum, and we've got the anus, or we call it the bowel. So these are the three openings into the three organs. The urethra into the bladder, the vagina into the uterus, and the anal opening into the bowel. So these organs, if I come up here now, these organs are in our pelvis. So this is a female pelvis. Men also have pelvic floor, but men do not really get problems with the pelvic floor until maybe they have prostate issues as well. But that's why it appears men don't have problems there. They do, but it's later on in life. Women start having issues here, maybe with childbirth and so on. But one thing I want you all to remember tonight is the pelvic floor. So it's all these muscles here we call the pelvic floor. For those who have had children, I'm sure you hear the midwife say, do your pelvic floor. And sometimes there's a misconception out there that is only if you've had children that you should do pelvic floor exercises. No, that is not right. As long as you are a woman and you are going to get older, whether you've had children or you've not had children, whether you've had normal birth or cesarean birth, as long as you're a woman and you're going to get older and you're going to go through menopause, you need to do pelvic floor exercises. And for you to do these exercises correctly, you need to understand where these pelvic floor muscles are, because they start from the pubic bone and they go all the way to the tailbone at the back. So that's looking at this woman from on top. So the pelvic floor is not your tummy muscle. It's not your bum cheeks. No, this is the bum cheeks here, and this is the tummy muscle up there. The pelvic floor is underneath, not, your tummy or your bum cheeks. So, and this second slide here is the picture of a woman like just lying down, ready to have a baby, and the baby is going to come through the vagina. And it's just to show you the whole of the pelvic floor muscles here. So it's good you understand these muscles because you really need them, especially when we are going through genitourinary syndrome of menopause. We need to do these exercises. Have I made sense with that? With the pelvic floor anatomy?
Yes, thank
Thank
you.
you. Good. So now let's go into how we look after the vulva during menopause. Like I mentioned earlier, the genital urinary syndrome just means the genitals, that's the vulva area, and the bladder symptoms, urinary. So as the vulva gets drier during menopause, we need to look after it. If I have my way, I will make sure that every woman from 40 years is taught vulva care. You don't need to start using anything fancy. You don't need to use any douching. It upsets the pH of the vagina area. It upsets the pH around the vulva. All you just need is just a gentle emollient ointment or cream to wash and moisturize with the vulva, not inside. So the vulva, that's why I explained earlier, the vulva is just the outer part. You use emollient cream, and the next slide, I will show us examples of what emollient creams are. So that's just the vulva. And with the vaginal tissues also getting drier, you may need to use vaginal moisturizer. And it's also good to make sure that we use pH neutral lubricants because they help what we call what we call pH is like the tissues and the I'm trying not to use medical jargons here, sorry. The secretions around the vagina area needs to be balanced. You don't want it to be too acidic or too alkaline. You just want it to be like just neutral, like water-like. So we don't want to be introducing too much of perfumed products, but we just want to use lubricants for intimacy that are pH neutral. And also some women may need what we call local vaginal estrogen therapy. I prescribe this a lot to most of my women who come to me in clinic with pain and also bladder problems because it's part of the advancement in medicine. And some women will say, oh, I don't want to use any hormonal because of breast cancer and so on. I'll talk about that later briefly, although it's not my area of expertise, but I'll talk about it briefly. But these local vaginal estrogen, they are just creams or little pessaries that will pop into the vagina, and it's a real game changer. It makes life easy for women. They feel more comfortable there. And when people come to see me, they often ask me, why has my GP not prescribed this to me? And I always ask them, did you really explain what was going wrong to your GP? And they go, oh, yeah, I saw a male GP. I couldn't really express myself. So it's always good, you're aware of this and you don't just want to suffer in silence. And also, as women, we also need to regularly check the vulva, not every day, but maybe just once a month. Like the way we check our breast regularly, we should check the vulva as well because of the hormonal changes. And we can monitor any changes. It's always good that we always report that as soon as possible and not just keep observing. And then the last bit is pelvic floor exercises. It's good you perform the pelvic floor exercises regularly to prevent prolapse, to prevent bladder problems, and to prevent bowel problems as we get older. And I want to correct something here tonight that people say, oh, you are expected to wet yourself or pull on yourself as you get older. That is completely wrong. It's because women have not been taught pelvic floor exercises. That's why that happens. So if you do your pelvic floor exercises properly, you will minimize the risk. If you can't do it, ask for a pelvic health physiotherapy referral so that you can be put through how to do these exercises properly. So these are examples of what we call emollients, right? So these are the ones for the vulva. They are not for inside. It's just to make sure that the vulva is moist and healthy. Then these are examples of what we call vagina moisturizers. They are different from vaginal lubricants. The lubricants are for intimacy, and these are just vaginal moisturizers, and sometimes they can be used as alternatives to vaginal estrogens. Um, the next thing I'll talk about is lifestyle during menopause. So I also work closely with the nutritionist, in terms of, when women start experiencing um, bowel, bowel problems during menopause. Like some women will say, oh, I have a lot of bloating, uh, you know, I have a lot of flatulence, I have a lot of indigestion, and so on. So I work closely with the nutritionist and we can work together to advise these women. So we always say maintain a healthy weight, make sure your body mass index is within normal limit. um, Exercise regularly. You can start with low intensity exercises. We know the benefits of exercises. It helps your mood, it helps it helps your heart, your cardiovascular endurance. And if you've not been exercising before, don't just go and join one crazy class and start doing very high impact exercises. You need to build up gradually. I had a lot of women just immediately after COVID who developed prolapse. These are menopausal women who were following some very crazy exercises on YouTube or internet, during the lockdown. So I always advise when you are going through menopause, build up on your exercise tolerance gradually. Don't just go from nothing to 100. And in terms of looking after your bowel, I just put this there because this is more of the nutritionist job, reduce sugar intake, reduce caffeine, reduce alcohol, drink very well. You can drink water in various forms if you like it hot, cold. You can drop fruits in water, and eat healthily, soya beans, food that are very rich in plant estrogen, like tofu, linseed, and so on, and have protein with every meal, and portion control, have adequate fiber, adequate vitamin D, magnesium, and probiotics. So these are just the general lifestyle, but I just work closely with these people as well, just to make sure that we make sure women go through menopause well. And the last bit here that I just want to talk about, which is not really my area of specialty, but I just want women to be aware of, is um, hormone therapy. And there's a shift from calling it hormone replacement because we are not replacing the hormone, we are just kind of topping it up. Because when people hear hormone replacement therapy, it scares some women. And there are various types of hormone therapy. They come in oral pills, patches, creams, sprays, and also there are some, through vaginal hormone rings. So with this type of therapy, there was a lot of scaremongering previously about when you use hormone therapy, you're going to develop breast cancer and so on. There's a good leaflet on the Women's Health Concern about understanding the risk of breast cancer amongst women. And actually, using hormone therapy, the risk is there, but it's not as much as when you are overweight. So there's a higher risk of developing breast cancer being overweight than using hormone therapy. And what I will say is if you are going through a lot of symptoms and hormone therapy will help you, you need to see a menopause specialist who can guide you and not just suffer in silence, and don't just listen to scaremongering. Hormone therapy is not for everybody, but if it's for you and you're going to benefit from it usually helps with the mood swings, the vasomotor symptoms. Then I will always advise seek help. Don't just suffer in silence. So to just sorry, I don't know why this is not working. There's, so additional information can be found on the British Menopause Society website, um, Women's Health Concern website, and there's also a website called the Daisy Networks for Premature Ovarian Failure, and there's the menopause.matters.co.uk. Um, just be cautious with the menopause matters because also there's some conflicts of interest there, but they give you a lot of information, very useful information, but don't be pressurized into, oh, do you want a consultation? No, just just be there for the information. And then the nutrition as well, nutrition on menopause. Um, you can get that on wellwellwell.co.uk. I signpost a lot of my patients to that website. So to summarize, women's experiences of menopause vary. You are unique, and your menopause is unique to you. Some women don't even know when they've gone through menopause, and some women, they experience mild to severe symptoms. So everybody is different. Be aware of symptoms, be well informed. If you are well informed, you can make the right decision. You don't need to suffer to be a strong woman or a superwoman because you just want to prove that you can go through this, whereas everyone can see that something is not right. Above all, you need to keep healthy, you need to enjoy your life, and your health is your responsibility, and you are in charge. Thank you. I'm going to stop sharing now and I can take questions.
Thank you so much, Femi. And that was a wonderful presentation. I've learned so much. I'm mindful of time, so we're just going to go straight to questions. And if anyone who is online would like to raise their hands, happy to let you ask your question. But there are a few questions in the chat box, so we'll just go straight ahead and ask it. So, someone is asking, can stress cause menopause?
Stress causes everything.
Absolutely.
Everything. Because not directly, but it can just affect one's period, you know?
Yeah.
So we always joke that, you know, when you are stressed, a lot of there's a system in our body we call the sympathetic system. And that system is like your fight or flight response. So it's being overworked every time. It's not calming down. And with that, you know, that doesn't allow things, nutrients, blood supply, everything to get to the right place. And that can start affecting the way the cells work in the body. So when women come to me, and I don't know, maybe it's by nature, uh, most women are very anxious, and we need to start learning, including myself, to start learning to do some breathing exercises, to start learning to calm down, and to start doing some exercises. Okay. So, and if we start saying to yourself that I don't need to stress, I need to breathe, I need to do this, I need to do, you know, just start talking to yourself like a form of reflection. That helps you to calm down a lot. And don't live in denial. I say that a lot. Don't live in denial. Yeah.
Okay, thank you. I hope that answers that question. Next question is, uh, what is hot flush?
Okay. So, so hot flashes are when you when you just get all of a sudden you just get very hot for no reason. So you can just be in a very cool area, everybody is happy, you know, you're all chatting, and all of a sudden you just have this overwhelming kind of heat from within, and you just feel so uncomfortable. And sometimes, if you're very light skinned, you can just turn very red, or you know, you just get really perfused, like your color changes, and and then within some minutes, it just calms down. And the way, you know, there's something called cognitive behavioral therapy. I didn't want to go into that. It's a way of managing menopause. They have evidence for it. So it's a way of you looking at things in a positive way. So when you go through hot flushes, like maybe you're in a very public place and you just get hot all of a sudden, instead of you feeling so embarrassed, like, oh my goodness, I'm really looking very flushed. You just have to say, oh my goodness, oh, this menopause. Okay, let's get on together, we're in for it. You know, you turn it into a positive attitude. You can fan yourself, you can tell someone, oh, can I just get your fan, you know, just make fun of it.
Mm,
And that helps you to calm down quicker than just getting so embarrassed. So it's just feeling very, very hot for no reason, and it just comes out from nowhere.
thank you so much. Another question from Teresa. After age 51, is
Mhm.
menopause reversible?
I don't know that, because that would be more of a, you know, inevitably we all go through menopause, and by 51 the eggs start decreasing.
Mhm.
I've seen women who don't stop period till like 57, 58. I've seen it.
Mm-hmm.
So everybody is different, but the average is just a guide. The majority of the women we stop having periods by 51. And if you need to reverse that, you need to speak to a specialist gynecologist about that.
Thank you. Um, Next question. Let me see if I can understand this. It's from Daniel. I didn't know that menopause can take so long. Can any symptoms be painful?
With
Uh, yeah. Another question from Evangelist Juliet. What is the best lubricant to use that is close to natural lubricants?
okay. All right. So we normally the most common one we recommend is called Yes Organic.
Yes.
Yes. So yes, like yes, yes, yes. So there are other lubricants out there as well. There's something called Silk and which other lubricants is there? Replens is a vagina moisturizer. So it's mostly yes, we use, but when you buy any lubricant, make sure that is organic and you look at the pH. But for me, I recommend yes because I get most of the samples in clinic. So
Thank you. Another question, is pelvic imbalance relating to menopause?
pelvic floor weakness, not
Mm-hmm,
yes. Um, Menopause is not the main cause of pelvic floor weakness,
mm-hmm.
but menopause aggravates the symptoms of pelvic floor weakness. Did I make sense with that statement? So, pelvic floor weakness would have been there prior to you going through menopause because the pelvic floor muscles, they like estrogen.
Mm-hmm.
So, maybe when you have children, or maybe there's constipation or there's heavy lifting, women can
Yes.
develop pelvic floor weakness from those
Mm-hmm.
types of activities, right? But we know that pregnancy and childbirth, they are the two biggest risk factors for developing pelvic floor weakness. So I've seen women who have never had children, but they have pelvic floor weakness because they've done very heavy lifting.
Mm-hmm.
And I've seen those who have been constipated all their lives. But when these women now start going through menopause, their symptoms becomes worse because the
Mm-hmm.
estrogen has been taken away, right? So it is not menopause that's caused it, but it just shows more symptoms during that period.
Thank you so much.
Yeah.
Another question, any example of floor pelvic exercises, please? I know this one would come up.
I knew, I knew that was why I left it to the end.
Yeah.
So, um, when we do, when I'm teaching women pelvic floor exercises, because most women have been taught with the verbal prompt of saying, imagine you are stopping wee, imagine you are stopping poo. And I say, when I'm teaching, I say, don't use that word for women because they can't stop wee and poo. That's why they've come here. So why are you telling them to imagine it? You know? So the first thing I always do is show them those muscles. I have a model. I don't have a model tonight, but I'm just going to use my hand. Can you see my hands up?
Yes, we
So,
can.
yeah. And I always say, think of your pelvic floor muscles. I showed you earlier that it's at the bottom of the bowl. The bulk of the muscle is at the back, close to the back passage. So if you put your two hands together, you can imagine that is the base of the pelvic floor. So the correct way to do that is to send signals, come to that part of your body, right? And people say, what do you mean send signals? The way I explain is, if you're in clinic, I just tell my women, I say, okay, lift up your right hand. They do that. And I say, how did you lift up your right hand? They say, oh, because I know it's my right hand and you told me to do that. I said, good. You know it's your right hand. Now your pelvic floor is the same voluntary muscle and is in that part of your body. So go to that part of your body, connect with your back passage. So imagine you are drawing up the back passage. You are pulling up. You always start from the back. You draw up the back passage, you pull up the back passage, or you suck up the back passage, and then you bring in the front, or you bring in the vagina. So it's a lift from the back, and then you bring in the front. So
Hey,
that's the correct technique of pelvic floor exercise. And pelvic floor exercises is not one size fits all, right? Because when you see a specialist or you can do a self-assessment, some people can only pull up and hold for like 3 seconds. Some people can pull up and hold 5. Some people can pull up to 10. So it needs to be individualized and you have to build it up gradually. So there are leaflets out there, and there's a website called the POGP. If you put on Google www.thepogp.co.uk, is a very trusted website, is the Pelvic Obstetric and Gynecological Physiotherapy website. And there are leaflets there in for pelvic floor. And the beautiful thing is you can translate into any language. I was shocked when I saw Yoruba there in the translation, which is my
Mhm.
so it's a very good website. If you go in there, you see the pelvic floor leaflet there and how to get help.
thank you so much. Um, Teresa just made a comment. Thank you so much. I've learned so much. Um, um, and Anya, really interested talk. Thank you so much. Evangelistic, Lady Evangelist, thank you for educating us. It is a privilege. Another question from Terry. What age can a woman start their menopause? So I guess Terry came in late.
So it varies for every woman. Let me just quickly answer that for her. So it
Yes.
varies, but the journey starts around 40. You have the perimenopause when your body starts winding down, and the average age for perimenopause is 47 years. And and then it just keeps going down, and then until women stop having period 1 year after the last period, we can categorically say that woman is officially in menopause. And the average age is 51 years. Some women can go longer having period, but it varies for everybody.
Thank you so much. Um, well, I'm mindful of the time, but there's a few
Yeah.
more questions.
Okay.
And I'll just go quickly. What is the best solution for douche? Water or soap or water and vinegar? And
Well,
that's now I don't know that one. So yeah,
can I just come in there? That's very bad
please.
practice with
Yeah.
douching, and it upsets the pH, and that's where many women start developing a lot of vulvar problems,
Hmm.
right? The vagina, I always joke, I said, think of your vagina like a self-cleaning oven. You don't need to clean it. It's a natural thing, except there's an infection. If there's an infection, you don't need to clean it, because once you start douching, you're upsetting the pH of the tissues around there, and then that can start leading to symptoms, right? It's not a sterile place, and that is why it was created for the purpose of, intimacy. And as long as there is no infection, you don't need to start sitting in sit bath, using vinegar, using anything. If you're going through any menopause symptoms, see your GP, they'll prescribe vaginal estrogen, but using vinegar, I hear that in clinic is very, very
Hmm.
bad. And that can start upsetting the skin, leading to all sorts of vulvar conditions.
Thank you. This question is from my cousin all the way in Jamaica. And she says, Winsome, she says, is surgical induced menopause more aggressive than normal menopause?
Yes, correct. That's a very good question. Thank you for asking that. So, surgically induced menopause varies depending on the age the surgery was done. Because I've had women who are 35, they've had hysterectomy. Once you have hysterectomy, even if they leave the ovaries, right? Because the ovaries, if you can remember that picture I showed you, the ovaries and the uterus is like a feedback loop, right?
Mm-hmm.
But once you now remove one bit, there's no more feedback from the ovaries to the uterus. So within 2 to 3 years, that woman can go into menopause. And if you imagine a woman who is just 35 in menopause, it's going to affect our bone health. Because there's not going to be estrogen to push for the calcium to be absorbed into our bones, right? It's going to affect our blood, what we call it cardiovascular, system. So I always say, if you have surgically induced menopause very early in life, you need hormone therapy. It's just for your long term because that's 35. If that woman lives till 80, that means she's without estrogen for 50 something, 50 something years, which is not really healthy for that woman. If a woman has surgically induced menopause around 51, 55 years, she's almost near menopause. So it's a choice if she wants hormone therapy or not. So things have evolved. That's why we always have improvements in medicine that and I always say it is God who has given doctors that knowledge to be able to look after people. So things have definitely evolved, and I sort of counsel my patients as well, compared to what used to happen in the previous years when you take a woman's uterus away, you leave her without any hormones. And then by the time she's 60, she's just breaking all her bones every time,
Mm-hmm.
and that will affect the quality of life.
Just a few more thank you from Elsie, Sinab, Evangelist Juliet, um, Winsome, and one person asking for the link that you had promised. And then I know that we're over time, and then I'll go straight to Dr. Abiola to
Uh,
give us the
Olga,
um
before Dr. Abiola comes in, I've got
yeah,
one questions, quick ones. Someone
okay.
is asking about this website, PGOD. Is it P?
Okay. I'm
I
trying to
found
look
it.
for
Don't
the
worry.
chart.
I found it.
Okay,
Yeah, okay. I'm trying to look for the chart to copy and paste, but I can't just seem to get the chart function here
Don't
on
okay,
worry.
my own screen.
okay. All right.
I've got it. I've got it. I've got the website.
The
I've just
next
put
one
it
is
on.
someone is asking, is IVF possible after age 51?
Ooh, that's for a gynecologist.
Yeah,
That's with
Tony, I
that's
left that.
yes,
Okay.
because that's for a gynecologist
Yeah,
and that's not within my own clinical competency.
It's good
right.
to let the person know. Finally, menopause seems to have caused a lot of problem in offices. This might be on a lighter note, but it's very important.
Mm-hmm. Mm-hmm.
I have this friend who is a regular attendee to this program, but he's not in here today. He said he leads a team of 5 women, and there are times when some of them are in low mood. It affects their performance at work. They
Yes.
are not able to tell him what they are going through, and he doesn't know whether actually it's menopause or something else. So
Hmm.
both of them are not able to help each other. How can they?
Good. So that's a very good question as well. There's now a new legislation that
Mm-hmm.
each employer needs to support women going through menopause now. So it's been passed, and women have the right to discuss their menopause at work because, like I mentioned earlier, the work population is really suffering because a lot of women stop working because of
Mm-hmm.
menopausal symptoms. So, because they don't have support from employers, it's not a matter of women's liberation, it's a matter of, making sure that women are looked after at work. So these people need to have open conversation. And at the same time, they should not take it for granted. So,
Mm-hmm.
and that is why we now have menopause specialists. There are
Mm-hmm.
menopause centers all over the country now. There are not many, but there are still some. So on the Women's Health Concern website, there are menopause clinic, both NHS and private. And these women can seek consultation there to actually determine whether they're actually going through menopause or maybe there are other things. So you can always say find a menopause specialist on the Women's Health Concern. So it's actually happening. Like the basic things you can do, like if a woman is going through hot flushes, just get her a fan. You know, that's a simple thing an employer can do if there are no emotional swings. So, but if the emotional swings, then they need to see menopause specialists because there are really many menopause specialists out there now. So,
Thank
did
you.
I answer the question?
Yes, 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 yes. Thank you.
Thank you so much.
Yes.
Dr. Abiola, who is co-chair. Thank
Hi
you.
everyone. I'm not sure whether you can hear me.
We can, loud and clear.
Yeah. We want to thank my colleague, my friend. I don't know where to start anyway, but uh, for me, someone I've known for well over 35 years, so I'm not going to go into too much details, but it's a great opportunity to have expertise shared with us tonight. We've learned so much, not just about the symptoms of menopause in various ways and how it affects various organs and how it can impact on our work life, relationship, and everything. We've learned about when it starts or it can start on the average. We've learned about our pelvic area, which is kind of very strange when women don't even know what they carry. So it's a good expose for women to actually know um, what it looks like, and not just that. How do we even maintain our pelvic in terms of exercising and all the myths about what do you use to keep the area, you know, not using soda or acid and stuff and all that because you want it to be super clean.
Hmm.
No, I mean, we've learned so many things in terms of uh, the websites, which is what is most important, signposting people to where they can actually get evidence-based facts
Mm-hmm.
and not just Google Play and Yahoo and YouTube and all the social media that you get confusing. In medical world, we base what we say on evidence, and that is why if it works here, it will work in Nigeria, it will work in America, it will work because it's been tried and tested in all those areas, and that is what we mean by is evidence based. So I want to join others and give our wonderful sister Fumi Odofin for a wonderful, wonderful, educative, informative section. We thank you. We glorify the grace of God in your life. We thank you for the knowledge that you have shared with us, priceless and immeasurable. God will continue to enrich you. It will strengthen you, and it will be with your family. On behalf of the host, the coordinator of this program, we want to say a very big thank you to you for coming on this platform to share this priceless knowledge with us. The Lord will continue to increase you in knowledge and wisdom. Again, we give you a big, big, big round of applause. And thank you so much. God bless.